So I don't earn the doctor title, but I got permission from my 14-year-old daughter to wear a white coat in a room full of doctors and doctors in training. So thank you, everybody. I'm delighted to be here. All right, let us begin. How do we succeed in letting the baby boom bust healthcare? So people 65 and older will more than double by 2050. Several of my distinguished speakers have already mentioned that. So while aging is not a disease, although recently I've seen articles about that very topic, the people coming of age could kill healthcare. So who am I? I'm someone who has cared for seniors since I was in high school, and I'm frankly scared about what's happening in healthcare. But this is very optimistic to be here today because I have such faith that everybody in this room can make much needed change happen. So I started my work with seniors, and I often talk to this topic with those that I mentor. My friends in high school went to the right to go candy stripe in the hospitals to take care of people who are sick, and I thought I would go to the left, go home and start cooking with healthier ingredients to help my grandparents live longer, healthier lives. And then I started doing that for many seniors throughout my home state of New Jersey. And what became my profession started as a passion for helping older people. So the countdown has begun. We are running out of time and the resources to care. And this is problematic, so I thought I would organize my presentation with the countdown of 10 precautionary problems. We're running out of money, Medicare, by 2036 if nothing changes. And I said, because we know that's not going to be the case. So let's start at the top, number 10. Ignore preventative care. So prevention is the best medicine. I think this is not a devastating point to those in this room who are studying medicine and practicing medicine. I think it's a very promising point. Because over 75% of US healthcare costs are tied to chronic diseases or largely preventable. And when Blue Cross Blue Shield looked at the ROI on investment in preventative measures, what you see is for every $1 spent, there's $3 to $10 in reduced healthcare costs. So this relates to what you see as plant as medicine movement and keeping older people engaged and continuing to learn. So prevention is the best medicine. In 2020, I launched Vitaly Society after over 2 decades in the industry of senior housing. And the reason was that 90% of older people choose to remain at home. So I loved what Alex was saying about care at home, because home is where people want to remain. And so what I did was decouple the real estate from the services senior housing provides, starting with enrichment platforms. And this was 7 days a week, live programming for fitness, wellness, and enrichment, with the goal to offer varying degrees of intensity, short format 30-minute classes, 1-hour program. And the idea was to curate content that would help increase the stability, stamina, and strength of older people. And what we saw was weight loss. We saw physically and mentally improvements. We saw people who are going through various cancers, their conditions improving and getting through their treatments more easily. We saw people's balance improving, falls reduced, and most importantly, this connection and camaraderie that candidly is so paramount, which we'll talk about in a bit. So this pilot was about 4.5 years, and as the introduction indicated, we got tremendous publicity because of the work we have done and the transformation it has on people's lives. So number 9, assume that one-size-fits-all solutions work. Precision medicine, right? We hear about it all the time. More accuracy, more efficiency. So this is my father, and I was on a mission to his remission. Several years ago, he was diagnosed with amyloidosis. And when I spoke to former Dean Glincher, who was head of the Cornell Medical School, and I told her that that was his diagnosis, she said, that is deadly and difficult. But then what happened, months later, he was also diagnosed with lymphoma, leukemia, and cryoglobulinemia. So the high school level of science plus astronomy at Cornell, I had to help navigate my father's care. And it was so complicated. So they gave him ultimately the atomic bomb of chemo. And it nearly killed him. So when he was in the intensive care, I spoke to his physician who was in New York. He was in intensive care in New Jersey. And I said, what do we do when he gets out? Well, once he gets a little bit better, we'll resume the medication and the treatment. Now listen, you don't need an MD to know that that wasn't going to work. So I had to work diligently to save his life. But look at the statistics. Targeted therapies in oncology resulted in 42% improvement in overall survival versus standard treatments. And the National Care Institute reports that patients with genetically matched treatments have response rates of 60 to 80% compared to 30% for non-targeted therapies. So this accuracy is so profound and has such an impact on outcomes. And beyond that, now my MBA lens, the savings is extraordinary. So $60 billion annually in healthcare for improving treatment precision and reducing efficiencies, and also the idea of drugs, the adverse effects of drugs and the cost and the consequences of that. So number 8, over-rely on AI. Let's let the bot raise the bar, as I like to say, for your efficiency, accuracy, and empathy. I recently attended a Harvard Business School conference for women, and the professors displayed this data set. To summarize, essentially what this is saying is chatbots' responses to patient questions were often rated higher in quality and higher in empathy. I'm going to repeat that because that is not good, right? That was okay to hear at a Harvard Business School conference, but that's not okay to hear in this room. That chatbots' responses to patient questions were often rated higher in both quality and empathy. So I want everybody here to put their hand up and say we're going to do something about that, right? But here's the friction. Most older people, about 50% of them or more, they don't have reliable access to technology. And 30% feel confident using it. So that's the friction. We have a system that's going to lean into technology, which I believe is such a huge opportunity, and I'm an advocate of it and working with it myself. But we have to make note that older people aren't necessarily so capable or comfortable or confident using it. So that is something to think lots about. Number 7, neglect the importance of patient access and trust. So better access and trust clearly leads to better outcomes and satisfaction. But here's the challenge with this. So there are less than 10,000, roughly 7,500 to be exact, board-certified geriatricians to care for 60 million people over the age of 65. And we saw this population is going to double by 2050. So that means that one board-certified geriatrician has to take care of 8,000 older adults. And while I have tremendous faith in the medical system and most of my doctors that I get to see, that is a tremendous patient load. So trust in healthcare, though, is vital because we know that if patients have a better connection and trust their physicians more, that they're going to adhere to the protocols and have be better outcomes. So some would say, let's lean in on the nurses and the other resources in the healthcare system. But the challenge is, and this might be a little bit hard to read from far away, as of 2020, there was already over 1 million person gap in nursing. So when they looked at the projection of the workforce, and you can see this downward slope, versus the demand, that's expected to grow. So that's a real challenge and something to think about, hence the hospital at home that Alex was talking about, and making those that are in the system more efficient and happy so they don't leave is so vitally important. Number 6, undervalue value-based care. I think value-based care is invaluable. So we want to help the system and those in it do better by keeping people well. So Humana, Medicare Advantage value-based arrangements, did a study, and it resulted in a 23% reduction in medical costs versus traditional Medicare. And these value-based initiatives are also seeing an improvement in medication adherence and a reduction in hospital-acquired infections. So it's no surprise when you look at the growth projection of value-based care, resulting in potentially $175 billion market by 2032. This works, and this works well. So underestimate the impact of evolving Medicare and Medicaid challenges. That's number 5. They look really scared, and so am I. There's not much to say here other than Medicare is expected to run out of money, as I said, by 2036 if nothing changes, but it is almost impossible. When I built this slide, and one day I said it's not going to be cut. The next day I changed it to it will be cut. The following day I wasn't sure if it was cut or not being cut. It's very uncertain and unpredictable what's going to be, so we will leave it at that. Assume bigger and better is number 4. So smaller organizations, interestingly, could lead to better outcomes. So all of us have heard about private equity investment in healthcare, which is a vital force of growth and success in this industry. My husband works in private equity, and I am an advocate of it. However, there are risks associated with it, and Robert Wood Johnson Foundation did a study and showed that the larger healthcare organizations sometimes have greater costs than the smaller community-based hospitals who actually have better care. So bigger isn't always better. I was speaking to one of our members of Vitaly Society who lives in rural Pennsylvania, and she was saying that her physician offices have closed, her hospitals have closed. It's almost impossible to get sufficient health care where she lives. Yes, virtually, but she has many chronic diseases and she was managed by local care, and now she doesn't have access to it. And I said, what happened? She said there were various different buyers that came in and shut down these facilities and practices, which is very sad. So we need to think about how to optimize the investment of private equity versus eliminate it, but use it in the most optimal of ways to achieve the outcomes we're seeking. So I say explore efficiencies, yet avoid deficiencies. Number 3, neglect community as social determinants of health as an opportunity. So I think there needs to be a prescription for connection as the really good medicine. So that's the community of Vitaly Society, a bunch of us from New York City. We put on our shirts, we got together, and it was featured in Entrepreneur magazine. But in reality, loneliness kills. Vivek Murthy, who's a Surgeon General, made that very clear. It's like smoking 15 cigarettes a day worsening your overall health. So I'm an advocate and a proponent of grassroots, local, virtual, whatever it is, peer-to-peer. When my dad was so sick, when I found the Facebook community for amyloidosis, I was so grateful that those other caregivers and even patients that were in part of the community were so generous with their insight and information and their research and what they've learned and what they've heard and what they've experienced. So in the best of worst in times, community is a lifeline, and I really believe is an often overlooked part of healthcare. Number 2, ignore disparities in access to healthcare. So health equity is a huge opportunity. If we don't solve it, it will impact population health. Full disclosure, I studied social sciences at Cornell, so this is something I think a lot about, but it is not about only serving a piece of the population. We've got to get it right for the entire population, because when it comes to healthcare, those who have the least access tend to need the most care. Not always, but I think statistically speaking, that's what I've seen in terms of chronic illness. The comorbidities and challenges that lower income people face are higher. And so the idea of 1 in 3 Americans live in an area with shortage of primary care and these health disparities that contribute to lower life expectancy. We've got to level the playing field. We've got to work together and try to solve this. We won't be a nation that's well without serving everybody who's in it. And number 1 is to overcomplicate the patient experience. So less confusion is more compassion. So I believe that prioritizing the patient experience is great business, right? So 90% of patients feel confused or frustrated by the complexity of healthcare. But if you look at this cycle that I grabbed from one of the resources of hospital, various platforms, it's you take good care of your patients, they will be very loyal, the outcomes will improve, Your financial success as an institution or an organization or a business will improve. Your reputation improves because the only way to get good reviews online is to provide great care. And charging more for better care, improving patient retention, and then attracting new patients. So it is a beautiful cycle, and it really starts with the patient experience. I will just share, recently I went to an appointment at Preventative Cardiology at NYU. I am a Cornell girl through and through. My daughter was conceived across the street, delivered here, and my husband's been here for surgeries for his ankle. But what I'm saying is that NYU, I had my appointment. When I checked out, the woman who checked me out said, oh, I'll schedule all your other appointments that the doctor just wants for this preventative service. I said, great. She goes, go downstairs, get your blood work. I got my blood work. By the time my Uber came, my blood work results were ready in my app. I looked at it. I knew the doctor had looked at it. It was instant. It was wonderful. Thankfully, all is good, but it was wonderful to have that information so quickly. And in closing, to summarize healthcare's potential demise, here's the list of 10, if you want to take a picture. So no need to restate it, but let's flip the script. That's why I delivered it in this way. The idea that we have to improve healthcare in so many ways, and here's 10 different dimensions to consider. And please contact me, as my other speakers have said. Coordination and collaboration is key. These are very substantial, significant problems. Please take a picture of my QR code. That's my LinkedIn. I also have just written 2 white papers. One is on the future customer of healthcare and the solutions to improve healthcare, and I'll be happy to send that to you if you'd like that as well. So thank you very much, and I'm delighted to be here and answer a question.
Future of Care is New York City's premier community for healthcare innovation. To learn more, subscribe to our channel and visit our website at futureofcare.nyc.